about a 6 right now.
Oh. Usually his pain's a 7. So.
Okay.
Are you ready?
Yeah.
Okay.
Sorry, I was stretching my back.
Any improvements since yesterday, Alan?
Yeah. The tingling's not anywhere near as bad.
Good. Good. Yeah, numb and tingle, like if you feel it temporarily, I'm not so worried. If it's like all the time, that's a little more problematic.
Yeah, I mean, it's still there, but...
Yeah. And then are you sore in the area you were pressing on with the foam roll yesterday?
No.
No, okay. So you basically understand how to use the foam roll to like access that area. I wanted to be able to show you how to work with the lacrosse ball or tennis ball to be able to work like right along your spine. A lot of people who have, like, I think you said you have disc degenerative disease.
Yes.
And joint. Yeah.
Yeah. Like, have you been diagnosed with that by a doctor?
Yes.
Yeah. And the thing is, doctors give those things based on like the symptoms that they pick up to, diagnose someone. I don't really diagnose people, and what I have a tendency to do is go, "Oh, your back hurts."
Right.
If the muscles around your spine, let's say you've got like, so this is a vertebra and this is a vertebra, and you've got muscles, and those muscles tighten and they pull. It's almost like shocks on a car or like brake pads. You know how the brake pads eventually they just wear from friction?
Exactly.
And then if your alignment is off on the tires, it like makes the tires rub raw on an edge.
Yep.
The spine as a physical structure isn't that different. If the muscles are always doing that, it like pulls on stuff. My whole job is to like push on stuff and have this muscle go, oh, hey, wow, I can go back to like relaxed. A lot of people's pain is actually coming from soft tissue, in my experience.
Right.
Like I said, I had a whiplash. I probably got arthritis and other stuff. Sometimes these joints feel a little rickety. So long as I eat well and like reduce inflammation, keep active, stretch, I'm fine. It's manageable. Right. Yeah. And that's really what I'm hoping will happen with you. It doesn't mean you don't have disc degenerative disease or whatever. It just means that your condition is more manageable and then your pain levels are lower.
Right.
Did you have that lacrosse ball or tennis ball?
We have 2.
2 of them, okay. So I'm gonna screen share here in just a second, just to give you an idea of like some of the muscles that we'll be dealing with.
Okay.
Let's see here. I'm gonna share a screen. There we go. I'll move this guy over. So what we've got here, do you see up around here, this is the edge of the shoulder blade on this right side right here. And we don't have to worry about the names of like all of these muscles, but do you see these guys between the shoulder blade and the spine?
Yeah, the the paraspinals are.
Yeah, and we'll cover that in the next slide, actually. These are a little bit more superficial. So like sometimes a client would ask me, they're like, what muscle are you working on? And I'm like, I don't know. And they're like, what? Like, what do you mean you don't know? And the thing is, sometimes I could be right here, and I don't know if I'm hitting this part of the rhomboid, if I'm hitting this part, or am I hitting like more superficial or deeper muscles? Sometimes I have to play because there's like 3 layers of tissue that I'm pressing on, and I can't figure out which layer kind of has more tension. Does it make sense?
Exactly. Yep.
So the thing is like I often don't know exactly what muscle until I start moving people around. And when I lengthen just this rhomboid, and then you go, oh, I'm like, oh yeah, it's his rhomboid. It's between the shoulder blade and the spine. Because when I lengthen this, he gets like a more extreme response. Makes sense?
Right.
So in the next one, these are some of those deeper muscles we talked about, those paraspinals you mentioned. So they got
Yep.
fancy names like multifidus and rotatorius. These guys are much deeper, just right along the spine. So somebody can have like a whiplash. I've seen this before. They were so tender through those muscles that not only could I not mobilize them, if I just used my forearm and like leaned in, they were dying. I had to back up until I was doing this with a couple of fingers, like, hey, how's this? I had to use that sort of pressure because they had had a car accident and the tissue was so tender that it would be too much pressure.
Yeah.
But as I slowly softened it, it's like they started to get more movement in their spine. Make sense?
Right. Yeah.
If
Yeah.
someone has spondylosis, like he has that too, does that affect those?
You know, I had a student ask about this recently, and I need to do a video and then a little bit of research. There are some conditions. So there's spondylosis and there's spondylolisthesis. And I get the two confused because they've got these big, fancy names. And then also,
Right.
you can say somebody has this thing, but it doesn't mean it always manifests the exact same way or to the same degree. Does that make sense?
Mhm.
What I was worried about yesterday is we had the conversation about the spine itself. Like there's this, if you look from top down, there's this hole which allows the spinal cord to go through. If for some
Right.
reason, I've heard of people having this before, where the bone starts to grow and it starts to close down on the spinal cord. That's a bad
Correct.
issue. That's surgery because they have to
Yeah.
get the bone to like clean that out so that it's not compressing like a big, your spinal cord basically. Spondylosis, I'd actually have to go. Let's see. Let me stop the share real quick. Let me go into exit full screen. Let's actually pull up spondylosis.
Yeah.
The MRI would pick up that area.
So they're just defining spondylosis as a painful condition of the spine resulting from the degeneration of the intervertebral discs. I didn't actually realize that was how they were defining it. And the first thing they've got is like, is spondylosis the same thing as arthritis? What causes spondylosis? Let's see here, full screen again. There we go. So, I mean, I think it just depends. There's so many variables. When they talk about degenerative discs, those discs are like the brake pads. They're just like cushions. They're shock absorbers between the vertebrae.
Yep.
A lot of people over time just have like a natural, I mean, in other words, when we get to be 80, our discs don't look like they did when we were little kids, unfortunately. But don't worry, stem cells are coming.
That's right.
Yeah.
Yeah. So are you on the foam roll right now?
I am.
Cool. When you do that, and you did that naturally on your own, I didn't even instruct you towards it, does it feel better?
Yes.
Okay. Then that was my hope. If that feels better, what I want you to do is over time just explore on your own. I don't want to tell you as like a coach, like in sets of reps, how often to do it. I think as you practice, you'll get a sense of like how often to use it and how often to do that. The reason I'll use the foam roll first is this is big and broad. If I went straight into this, ow, this is kind of pointy. It's kind of sharp, a little bit more like my elbow. So I would usually start with this guy, and it's also easy for me to use this if I'm watching TV. I don't know, if I haven't had a good morning, I just had coffee, I want to lay on this. The other part is when I showed you how to use the pillows,
Just ate.
props. Say it again?
Said if you just ate,
Yeah.
eat a yeah.
Yeah, or whatever. I mean, in other words, giving somebody maintenance so they can work on themselves. One of the worst things I see with people is they're 7 or 8 on a pain scale. They're always at a 7 or 8 on a pain scale. And they have absolutely no way of managing their own pain. That's the worst. And what it leads to is depression.
Yep.
Because they're powerless. If I can take somebody and it's like, let's say, I don't know, we'll just make this up. He's got spondylosis. So he's got that condition. Okay. And he's at a 7 or 8. But if I show him how to work on himself and he can manually work on himself and reduce himself to a 5, almost at will, you've given him power over his body. You've given him some degree of control to make his life more manageable. That eases some of that issue. The worst thing I see is when the pain is high and it never fluctuates and they have no capacity to manage it. This is getting to like opiates. This is why people abuse opiates. They're trying to manage that pain level. Does that make sense?
Right.
Yeah. So where do you still feel most tender when you do that, Alan?
Where do I still feel most tender?
Yeah.
So the pain's actually more in the elbow,
Yeah.
surprisingly. And along the tricep.
Yeah.
It's not the tricep that's hurting though.
Yeah.
But I guess that's the easiest way to describe where it's nerve pain. You know, you can tell there's a huge difference between, or at least I can tell, between like nerve pain and like muscle pain, or you know what I mean.
Yep.
And this is definitely nerve pain in the arm.
Well, along your spinal cord, you've got those vertebrae, right? And those vertebrae are just like a support structure. And then the spinal cord is going down along. Between vertebrae, you've got a trunk that will come out on either side of the spine. That's when you see those pictures of the spinal cord where it comes out all down along the spine.
Right.
If you've had disc degeneration, and let's say, and I don't know this because I haven't looked at scans, let's say it's closed down a little bit. So
Right.
over here, this vertebra starts to like cramp the style and this trunk coming out on that left side of your arm. My whole goal is like, I can't do anything about the disc because I don't have it. I can't inject your stem cells or regrow it.
Yeah, we're not doing structural repair there.
But if I can do this and go, hey, let's stretch it open. Ooh.
Right.
Because if we can reduce, if there's any inflammation, if we can manually do that and reduce any inflammation, pain tends to reduce.
Right. Yeah. No, I've got like wedge discs and everything.
Yeah.
So, you know, where it's not perfectly round anymore. You know, it's kind of, you know, the cockamamie, I guess would be the word.
Yeah. And then manually just getting you to work on it. What I wind up doing is when I showed those muscles, those deep guys, multifidi, rotatories, all those deep muscles along the spine. Like
Yeah.
what's crazy about it is you've got those vertebrae, right? You can have a muscle that connects from this part of the vertebra, and let's say that my nose is the center of the next vertebral process. So it's like you could have a muscle that connects here to here, and all this muscle does is turn this. And if that one muscle says, hey, we're going to tighten up, never let go, it starts to pull that vertebra off just a little bit. Does it make sense?
Yep. Yep.
My whole job is to come in and put some pressure here and go, hey, what's up with this? And deliver an input into your nervous system, hoping that muscles will relax, let go, release, unwind. When I saw you naturally go to the foam roll like that, that's a good sign to me. Because he immediately, like when you said, oh, I'm sorry, I was stretching. I'm like, don't be sorry to me. Like, I'm trying to get people to do this all day. especially when they hurt, when they have pain, right? Yeah.
And he hasn't been able to sleep.
Yeah.
Either. So. But,
how was his sleep last night?
I got 2.5 hours.
And the night before was 3.
Do you wake up from the pain?
Oh, every day.
Yeah.
Yeah. And I mean, not to really be talking about, you know, medications or anything, but even if I'll take like 20 milligrams of quick release oxy,
yeah,
you know, that's still, you know, that might get me a 4th hour of sleep.
Oxycodone or Oxycontin?
Oxycontin.
Okay. Are you worried about being on it?
I don't take it anywhere near on a regular basis.
Yeah.
You know, I don't take like I do take daily pain meds, but it's more like ibuprofen or naproxen or something like that.
Anti-inflammatories, yeah. Anti-inflammatories, yeah. So the other thing is,
I try not to take the opiates on anywhere near a regular basis.
the way I treated opiates, I knew I could have become addicted to them. And you have to understand, I was in college. I was getting them illegally. Like, I mean, they were pills, but like you could just find somebody who they had an old root canal and some pills or something, because you just hurt so bad. When your pain levels are high and you take opiates, it makes you normal. It's
Yeah.
when you're normal and you take opiates that you get high. Does it make sense? Like,
Yeah, no, absolutely. I've
Yeah.
never gotten a high
yeah,
from
use and
taking-
abuse. And the thing is, like when you say Oxycontin, like we're recording this, it's like there's a big deal to people. They're like, ooh, it's like like it's heroin or something. And I'm like, yeah, like
Right.
if you're in pain, they'll give you morphine at the hospital, and it makes your
Yeah.
pain go away. So
Yeah, a lot of them. You know,
Yeah.
I've gone to the hospital, and in fact, Holly was with me one time.
Yeah.
They gave me one shot of Dilaudid, and nothing, didn't even phase the pain. It took like a second shot uh, of them doing that, and
Yeah.
I'm up and walking around, and the doctor's like, "You should not be up and moving," and I'm like, "I feel normal," He's like, "I gave you enough to knock out a horse," and I'm like,
That was the day after, well, he had a failed spinal stimulator surgery.
Yeah.
So the 1 week trial worked fine, but then during the surgery, the doctor had to stop. He wasn't a good candidate because he was flopping around and moving around, and
Yeah.
because of different things like PTSD can do that, or he just ended up not working, and he was in so much pain, and so that happened. But yeah, another thing, and with the sleep, like he's got tramadol. Is it not tramadol?
Trazodone.
Trazodone,
Yeah.
which that has so many other side effects. So it's like that's just not something you can take on a daily, nightly.
Yeah.
What Alan, when you talk to the doctors currently, what have they told you about your condition and like what your long-term sort of prognosis is?
Pain management.
Okay.
I've been waiting to see, if, the stem cell therapies will, kind of, it's beyond at this point, kind of anything that they'll do, unless like I get bone spurs inside the spinal cord
Yeah.
itself. They're basically at the point now where they're like, yeah, we're just gonna try to do pain management, and then it's a VA, and so they deal with a bunch of people that abuse opiates, that whole opiate, overdose thing where people were dying because they were getting fentanyl illegally.
Yeah.
And so they kind of cut all the veterans' pain pills, regardless of if you need them or not. So that's kind of what's led me towards the massage and this, and trying to find the alternative methodologies for pain relief.
Yeah. So the other thing that I'll say, and I'm a massage therapist, to a point, it's not like I can really give medical advice because I just don't know. Like I'm a mechanic. I'm a soft tissue guy. I rub on people for a living is what I joke about. One of the things I noticed, and I've lived with chronic pain since I was 22. So I can't give like nutrition information or advice because I don't know anything about it. Do you know anything about carnivore diet?
Yeah, like the kind of like the
Pescatarian.
no, not pescatarian. He's talking about things like I can't remember the name of that diet. Basically, where you eat like meats and dairy.
Atkins.
Oh, self-meat diet.
No, and some vegetables.
So
they call it
here's what I
paleo.
found.
Really?
I had a friend who was having some issues, and he came to me and started talking about the carnivore diet, and I went, "What?" I'm a cook. I've been a cook for forever. I always prided myself on having a fairly balanced diet between carbs and meats and vegetables and things. And he's like, yeah, these people, they have autoimmune conditions, and they're not eating anything but beef and fizzy water. And I was like, what? I was like, oh my God, is that like, that's not, And I was kind of confounded because, again, not a nutritionist, don't know anything. I'm like, an autoimmune condition? Like, what? I started doing more research, and of course, the carnivores are kind of like the opposite end of the vegans. They're
Right.
religious, but they're religious about eating meat and not much else. I shifted my diet this direction, and I'm not lying to you. Pain that I had for years all of a sudden went away.
Wow.
But I think it's because after my accident, my body's had some response. I feel like it's responding negatively in inflammation. Inflammation and pain seem to go hand in hand, which is why people
Yeah.
take ibuprofen, naproxen sodium, all these anti-inflammatories and things. It's why they give steroid injections. It reduces
Yep.
inflammation, right? When they reduce inflammation, pain goes away. I wouldn't tell you to start eating carnivore. If you wanted to do some research, there's a Facebook group called the World Carnivore Tribe. Now, when you join, be careful, they're religious. But there's a
Okay.
lot of good information there. The thing is, let's say your body is responding to inflammation.
Right.
It's a defense mechanism, right? But let's say, here is where I hurt. But what happens is if we reduce inflammation, I'm like, oh, I mean, yeah, it's rickety in my neck, but I'm okay. That's the
Right.
other thing I might encourage you to like look into and like do some research on,
Okay.
just to see, because I know in my experience it made a big difference, and it's not something I can again medically recommend, but it's
Yeah.
something that I'm looking into, and people seem to respond very differently to it. If we reduce inflammation and pain goes away, your quality of life increases, your pain levels are lower.
Absolutely. Yeah. I call it my pain cycle.
Yeah,
So my swelling, the inflammation, it causes pain because it's pressing on the nerves, which tells all the muscles and everything, hey, whoa, 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 we don't like that. Let's lock it up.
yeah,
And so that creates more swelling, which creates more pain, and you have to try to break that cycle.
yeah,
And you can't just break it all at once. They don't. Well, they do make drugs good enough for that, but
yeah.
they risk of killing you. uh, um, but you gotta try to lower. You either got to lower the pain to get the swelling to stop, or you got to stop the swelling to lower the pain.
Yeah.
So that's why I use a lot of ice packs. Anything that tries to draw blood away from an area,
Yeah.
you know.
Yeah, I see arguments too as a massage therapist. There have been debates about ice or heat, like
Mhm.
cold or heat. And I don't have like a strong knowledge base on that. I've done like a huge amount of research on it. In the end, whenever you tell me you do something that makes you feel better, I'm like, great. They're like,
Right.
what do you do when you hurt? I'm like, well, sometimes I drink.
I
It's like,
do wrong. Captain Morgan, we're
yeah. I mean, and I don't encourage it necessarily for that, but it's like there's a reason people drink and smoke and do whatever else they do to alter themselves. Do you have your lacrosse ball?
I do.
So I got a Dunlop here. If Dunlop wants to sponsor me, they can contact me. And
Right?
what I'm going to do is, just like I use the foam roll across my spine, what I want to be able to do, you remember those rotatories and multifidi, those guys right along the spine?
Yep.
I don't want to press in the center. I want to press a little bit to the side. In your case, it'll probably be on the left. If I was on the floor, what I'm going to do is kind of put this guy down and see if I can hook it between my spine and like my shoulder blade. I can move like, ooh, up and down. I could, again, find that spot. If I'm holding my head off the floor and I feel like I need more support, I can put that pillow down so I can lay my head back. In addition to pushing on the muscles, what it tends to do is you're putting enough pressure around those facet joints and on the transverse processes that you're getting a little movement in the spine. You may find like one side or the other just makes you, I don't know, just makes you feel better. You're just like, oh, right there. It's like the elbow that you can't get the therapist to stay there for 15 minutes.
Right?
And then it also doesn't matter to me if you work on one side or the other. I would usually encourage you, even if the left side is the one that feels the best, is to also work on the right, just to feel like a little bit of balance, to see what's going on from side to side.
Okay, yeah, definitely.
Does he need a pillow for his head, Holly?
I do.
Yeah.
No, I'm perfectly good with where the pillow's at right now. Yeah, the lacrosse ball is definitely a lot more structurally. There's no give to it, unlike a
Yeah.
tennis ball.
And that's usually why I start people with a tennis ball, but we work with what we have. The one that we build up to is like a golf ball.
I've done that on a wall, and it leaves a nice texture.
Yeah.
Oh,
I use this for piriformis syndrome.
Yeah, the gluteals.
That's so good.
it does, yes.
I'll wake you up
And here's the whole thing. It doesn't mean disc degeneration goes away. Doesn't mean his pain levels won't maybe return to normal, like his usual level when he's done with this. When you just go, ugh. Here's the thing. If all I do is allow him to distract himself because he mashes on himself, victory. It just makes it manageable. It means if you can do this comfortably and muscles aren't bruised or sore, it means you could do this as many times a day as you wanted just to manage that. Normally what I find is people's pain levels start to drop. The other thing is I've seen this before, Alan, in like research studies. They actually,
Yes, sir.
when people were in pain in the hospital and they had like a morphine drip, or they were being, not a morphine drip, they were being given morphine by the nurses. They've been,
Okay.
they got some sort of pain issue. They're in the bed. The orderly or the nurse or whatever has to come give them morphine. They found that if they just gave the person a morphine pump and gave them a button and allowed them to give themselves morphine when they wanted, that they actually used less of it.
Oh.
And the reason why is because they're in control.
Yep, that makes sense.
They didn't have to wait on the nurse and like, I'm dependent, I need it now. They could go, oh yeah, I'm okay, right? The whole thing, I don't know, there's a weird issue with like opiates in our country, especially because of the Oxycontin epidemic. But being somebody who was in chronic pain, like I have a more, I have a strong resonance with that population. One of the things I always find, Alan, is like when I talk to you as a client, when I talk to you in person, my sessions are real long, so I might engage with you for 10, 20 minutes and just let you talk about your experience with your pain. And people feel like this, like you can see it in them, especially if it's gone on for a long time. They're like, oh, they get real uncomfortable, like they don't want to talk about it, because what's happened is over the years at dinner parties and family events, they don't want to talk about the fact they're in pain because people around them get uncomfortable because they don't know what to do.
Right.
And for me, I'm like, yeah, tell me about your pain. Like, I know.
Yeah, right. You know, having lived at that address for so long, you know.
Yeah. Because, I mean, it starts to affect your life. It starts to affect your relationships. When you go to the grocery store, it's not just, is there any bread on the shelves because there's a pandemic going on. It's like, is there any bread on the shelves? There's a pandemic going on. And I hurt, God damn it.
Yeah, exactly.
And it's like, where's this anger coming from?
Yeah.
Are you hungry? Oh. No?
Did you try both sides?
Yeah, I'm on the other side right now.
Yeah. So the lacrosse ball, the tennis ball is easiest. It gives like the most give. It's the most, squishy at first to get started. You could build up to something like a golf ball. I don't think there's any harm there. So long as you don't feel bruised, so long as you don't feel sore, you're just working on that tissue right along the spine. The foam roll is big and broad and helps you kind of open the chest. This helps you do spot work on like specific muscles right along vertebra.
Yes, that does.
I'll tell you another story real quick. I started doing yoga years ago because I was looking for anything I could to like help me. And my neck was always like the pain area. And we would
Uh-huh.
do lots of standing poses, lots of hamstrings and hips and using your legs to stabilize and triangle pose and warrior and all this stuff. Lots of legs and hips, lots of legs and hips, lots of legs and hips. And we'd finish class and I'd go, huh, my neck feels better. But I think what it was I might have pain here, but when I did something that required my body to focus on my legs and focus on my hips and focus on my lower body,
You're no longer
it just shifted my attention.
Yep.
It would be like, say it again?
It'll distract you.
Yeah. One of the things I noticed when I was in massage school, because I had, neck pain, right? Like it was always great to receive work from people. That felt great. I found it the most interesting that I felt better when I worked on other people. So when I worked on you, Alan, I experienced less pain because just my attention shifted to working on you.
Right.
Yeah.
Well, that makes sense. Yeah.
Yeah. So do you have a second lacrosse ball? Because he's using one, right?
Yeah, you can use both of them too.
So yeah, this is what I wanted to do. So Alan, if it's okay with you, if it feels like you're doing good work up here, can you take the other lacrosse ball and put it down in your keister?
Okay.
Because now you can work on two spots at once.
Ooh.
And are you working on the lower portion? You work on the left side or the right side?
I'm working on the left side, lower, right side, upper.
Okay. So with the leg that you're working on, the gluteal that you're working on, what happens if you take that knee and let it kind of roll open?
Like.
Yeah. Because you're just changing the position of your femur to be able to access through there. If you feel like when you roll out to the side, if it feels like it's too much strain, you could put a pillow underneath your leg there if you wanted to hang out.
Okay. No, Holly, just let it be for right now.
And what I tend to do is if I'm working on two spots, it's almost like I'll toggle. I'll kind of let my neck hang out or my upper back hang out, and I'll go and focus on this for a second.
Yeah.
Find a good sweet spot, then hang out on this and go back here, and then work on this spot again. Kind of toggle back and forth.
Well, except for Holly, that I'm actually moving the ball using my leg, which I know sounds weird, but it's rolling the muscles around the ball, basically.
So when Alan gets quiet, to me, it's like the beginnings of like the pain or the intensity can be so exquisitely tender. It's like everything else starts to fade into the background. I'll have a tendency to try to get you, Alan, to breathe because when you inhale, muscle tension tends to increase just a little bit. And on the exhale, you relax, release, unwind, like sink deeper into what you're doing. I have a tendency to let people modulate that pressure using their breathing and just encourage them to kind of go towards that single pointed focus, that exquisitely tender, hanging out on that spot. They seem to get more benefit if I can put them in position and let them hang out there a while. Like when we put you over the foam roll, if we did it without the pillows, it starts to become too much pressure. It's too sharp.
Right.
But if I prop you and make the pressure broad, they can hang out there for 15 minutes. When I get them up off the foam roll after that 15 minutes, they're like, oh my God. Like
Yeah.
it feels just completely different. And that to me is the sweet spot.
Absolutely. And it'll be weird because I'll be doing like square breathing while I'm doing this.
Square breathing? What's that?
So think of it as like inhaling for 2 seconds and then holding for 2 seconds, then exhaling for 2 seconds, then holding for 2 seconds. So
And sometimes it's recommended to like draw out with your
Oh,
finger
like to visualize it?
Yeah. And so that it helps me to kind of control the muscles. I know it sounds weird, but like it's like the whole mindfulness thing.
Yeah. Yeah, I got into yoga and meditation because of all the pain stuff, but it didn't make sense at first. Like I didn't even know what meditation was. Because of the physical pain, it drew my focus down to a specific focus, one point, like pain. Like people would ask me, like, do you meditate? And I'm like, yes. And like, what do you meditate on? I'm like, pain.
Exactly.
It's normal for us to want to gravitate away towards the pain and not think about it, or society tells us like, oh, just don't think about this or don't think about that. But honestly, with dealing with certain things, and what meditation often is not going away from that thinking. It's diving into it. Yes, I'm in pain, and then breathe through that pain, work through that pain, think about the pain,
Yeah,
and just breathing through it. And yeah.
Some of the best body workers and massage therapists I've worked with have gone through some of their own healing crisis. They've had some major issue or something, and then much like me, kind of learned about it, took that, and then like started working on other people and like sharing with them. They have a stronger resonance and I think understanding of chronic pain internally. And then they have a deeper emotional bond with clients who are in chronic pain, I think.
This has got to look so weird. Look, I'm thinking about it now. Looking at me on video, just kind of like rolling around, moving just a little tiny bit,
I mean, like you got a couch behind you. So like we did the foam roll and kind of let you do that thoracic extension, right? Like I got to the point where I was open enough where I would just like lay upside down on your couch and do like a back bend over the couch, because it allows me to open up my chest. And like I'd go to people's homes and like look at their furniture, and their furniture is shaped differently. So I'd be like over the side, over the arm of the couch, because they would press right into my thoracic spine, allow me to do a back bend. And people are like, dude, what are you doing?
Right? I'm using other parts of the couch. Don't mind me.
Or I've used like people's counters, if they had like a nice marble countertop, but the edges were rounded. You could find like a groove to like press into my shoulder blade, and be like sitting there kind of, digging into their countertop, stuff like that.
Yeah, sometimes she'll sit on my back.
Yeah.
And it won't pop or anything, it'll just like the pressure kind of helps sometimes.
Yeah, the connection between, so like if all I did was talk to you, Alan, and I never put hands on you, and we just, in other words, we didn't even do any physical work like on yourself. We just talked. If I took a pain scale and we talked for an hour, kind of like talk counseling, normally people are going to feel less pain whenever it's over. Why is
that? Just, it's not even distraction, I guess. It'd just be being mindful of where you're at, and
Humans are social creatures. Something I did years ago, my sessions got longer and my fees went up And then we kicked off the Thai massage jam. And the Thai massage jam has been interesting around the Austin area because people they're not quite sure what it is or what's going on. And I go, listen, I show up with my mats, and anybody who shows up, I work with them, share with them, teach them, and show them how to work on each other.
Okay.
And they're like, well, what? I'm like, it's a community bodywork event. And they're like, what? And I'm like, guys, you can show up and pay $5 and I just show you how to work on each other. Like I could work on Alan for 5 minutes, figure out where he's tight, and then go, come here, Holly, and show you how to put your knee in his back or whatever.
Yeah.
Right.
It's almost like couples Thai massage or couples massage on steroids because everybody's clothed. Everybody's working on a mat, and then I'm like supervising and showing people how to work on each other.
Cool.
And people are like, what? But you're not getting paid. I'm like, this is like huge exposure. Like people are, like I had a lady call me and this has been years ago. She had, $30,000 in medical bills. She couldn't come see me. She couldn't afford it. And I said, yeah, you could just come to the Thai massage jam. She's like, what? And as I explained it to her, she's like, oh, okay, well, I'll see if I can come out. She came out like, if we started at 8:30, she came out at like 8:20. I worked on her for free for an hour. She came back 5 or 6 weeks in a row.
Wow.
Early every time because she knew if she got there early enough, I'd be there to work on her again.
Right.
So she just got hours and hours of free work. And it was like, I don't care. Like it's almost like this little community giveaway. Like I'm dying to teach people to work on themselves. But it's interesting to me because I got the message from you guys after pandemic hits. When people know they can't come see me, they're looking for, alternatives. So it's like, I almost want to, scale it out in some way because people just don't realize what they can do themselves with a tennis ball and then what I can do to like teach them online.
Yeah, the cost that you would, I mean, not to get too much into personal information or anything, but the amount of money that's been spent on my back, I could probably have an Iron Man suit. And I'm finding that, I still don't have the pain relief. Definitely not to where I want it, but being able to, find things that bring even temporary relief, even if it's for an hour or two, which, that's it, unless you've sat in chronic pain, you don't know what having, just the muscles relax for a few minutes even is worth. Going from a 7 to a 5, is like, oh.
2 points. 2 points on the pain scale over the years. I try to be content with that. Sometimes it's more after a session, but if you can help people moderate by 2 points on a pain scale, it's like it starts to give them their life back.
Yeah, exactly. It's like clouds parting, the sun starts shining down on you, the grass is a little greener, the air is a little sweeter.
The people are nicer.
Oh yeah. I've seen people in chronic pain. I was warned one time. I worked at a spa, and this lady made an appointment with me in the spa. The management basically came to me and said, "Robert, this lady's crazy." And I went, "What?" And they said, "This lady, she curses. She's crazy, Robert. I don't know what's wrong with her. She's just nuts." And I talked to her, and when she was like 17 years old, she was in like a horrific car accident. She's living in like 7 and 8 level pain for 20 years.
Yep.
Seems very terse and very abrasive and curses a lot, but it's like she's in pain.
Yeah.
She doesn't care about your feelings.
Right.
she hurts. Yeah.
To do a Thai massage jam sometime.
Yeah, for sure.
We'll go to the Thai massage jam.
I don't think they're probably holding them right now.
No.
Yeah, we can't right now, of course. But yeah, it's like in my world, if I could, I would go to the VA and I'd get all the veterans to work with each other. You know, come here, Ralph.
Yeah.
Let me show you how to use a neon gym, you know, and work on each other. People are also just social. Having a social structure and support for people in pain. It's like, I call it time massage jam, but if you called it like, you know, community pain relief or something like that, that's more so what it is. It's like allowing people to come and like hang out and work on themselves and work on other people and learn a little bit. Massage therapists are interesting to me because you have to have a license to charge for massage. They sometimes think everybody has to like learn all this amazing anatomy and physiology to be able to work on people. And I'm like, dude, it's like if you work on a car and like change spark plugs, you could get a Chilton manual. You just got to open the thing up and take the spark plug out and replace it. Like anybody
Right.
can learn to do that. You don't have to be a mechanic. Like massage therapists, there's this thinking sometimes where it's almost like they're afraid to show Holly how to work on you because they're afraid you're somehow going to get more injured. I'm like, no. Long before he gets injured, he's going to go, ow.
Ow.
Yeah.
Yep.
Too much. Yeah. And in fact, I think the quality of your education, the quality of your relationship, the quality of the connection you have with the people around you actually increases by teaching a skill like this just for maintenance.
Absolutely.
So whenever you finish up, Alan, just I want you to go ahead and sit up, and we're gonna see where you are today.
Okay.
When you started today, where was your pain level? 10's hospital, 0's no pain. Where were you at?
Probably. Oh, I was hurting, so probably a 7. And it's weird because it went up a little bit at the beginning of the foam rolling.
Yeah.
Oh. So it went up while I was actually foam rolling. At least at the beginning of the foam rolling, you know, because muscles are like, you know, don't leave me alone, you know, and,
Yeah.
you know, hitting it with the foam roller. Right now I'm probably at a 5.
2
I'm
points.
actually,
Dude,
yeah.
listen, and here's the thing, it's always like this. If I had worked on you and you reduced by 2-3 points on a pain scale, if we could do that once, we can do it again.
Exactly.
If we do it again and again, what happens is I notice people's pain level, let's say you get to a 5, it'll start to drop to a 4, and then sometimes a 3. And a 3 is annoying, but it's like so much better than, you know, 7 or 8.
Than a 7, you know.
Yeah.
Absolutely. And in fact, it's funny because so my back is generally where a lot of my focus of my pain is. And right now, I'm not actually getting a lot of pain from my back because I've, just been sitting there with the lacrosse balls and everything.
Yeah.
I'm actually feeling more pain in my right shoulder, which hasn't been bothering me.
Yep.
But because the pain is lower in the other spots than it normally is, it's like, oh, wait a sec, yeah, you know.
It's sometimes I don't know if there's a medical term for this. I always called it first things first. I had problems with my neck, right? I worked on it for years and years, and then all of a sudden I got low back pain.
Uh-huh.
The thing is, I think most of this had addressed, it was almost like the low back pain might have been there, but my body didn't let me feel it. It's a joke I made because I have 2 younger brothers, and my brother would say, ow, my shoulder hurts, and I'd punch him in his other shoulder.
Yeah, exactly.
Yeah.
You know, and while you joke about that, you know, Major Pain, the movie, here, let me see your finger, you know, and dislocate the one joint. He's like, see, now your shoulder don't hurt so bad no more, you know?
It's maintenance. What I would have you do is, as much as you feel comfortable with, you can use the foam roller.
Uh-huh.
You can use the lacrosse ball to work on that. I think that gives you enough play, like enough versatility to be able to work on this daily, however many times a day you feel necessary. What do you say about like maybe in 3 or 4 days, just contacting me again? We kind of check in again, see where you are.
Absolutely.
Cool. Yeah. That way I want to see, for instance, like on a daily basis, usually before you started doing this, you're normally like 7 or an 8.
Yes.
Okay. And
Good
then
day would be a 6.
about a
A
6
good
right
day
now.
would be a 6. Bad days an 8.
Bad days in it. Okay. Because I want to see what happens if you do it for 3 or 4 days in a row. I want to see if it starts to like drop a little bit, like if it's a little more manageable.
Absolutely.
Yeah. Cool. Did you have any other questions for me?
No, I mean, no, good workout.
Cool. Well, I'm glad it helps, and it's good for me to like work with people online this way and try to figure out how to help them, succinctly. So yeah, thank you guys. And then again, just in 3 to 4 days, Holly, can you just message me?
Sure thing.
Yeah.
And feel free to post this, in case somebody else can,
Yeah,
benefit
absolutely.
from.
This raw recording, it'll wind up on Facebook and it'll wind up on YouTube. I just put it out so other people can learn from it.
All right, absolutely.
Cool. Listen, thank you guys so much. I really appreciate it.
All right, I'll
Thank
check in
you.
with you in a few days, sir.
Appreciate
Sounds
ya.
great. Thank you.
Thank you.